registration desk and confirm your presence for today's convocation. Once done, kindly collect your convocation gowns from the attire counter. We look forward to celebrating your achievements. Thank you for joining us and helping us start on time, and the convocation will start immediately post-lunch by 2 p.m. Thank you.
Thank you. May I request Dr. Kavita Reddy, Dr. T. Dayalan Singh, Dr. A. Chakradhari, and Dr. Gutta Srinivas. Dr. M. Prabhakar Rao, please join the stage. Over to you.
Thank you very much. So, just to quickly start, my name is Mahesh Iyer. I work at Bristol Myers Squibb. And so normally I'm used to it. So a lot of my talks typically tends to focus on use of AI in the pharmaceutical space, right? How do we use it for drug development? What are the different areas of drug development, clinical trials, where we use AI? Today, the talk that I'm supposed to give is slightly different, which is how do we use AI in healthcare delivery, where, how, all of those sorts of things, right? Now, I'm sure it looks like even just the first two talks today, and then a lot of talks we have had, must have had yesterday. A lot of people have focused on, what I call the art of the possible, right? What is possible with AI, right? I heard Raja speak a lot about the research work that's happening in the AI space. And then we heard Dr. Arun Raj speak a lot about when do we use AI in the cardio space, how do we diagnose, how do we predict, a lot of cardiac complications using AI, right? So I want to stop. I mean, I have a whole bunch of slides that talk a lot more about, where do we use all of these different things. But I want to really stop. Having heard the first two talks, I want to try and see if we can ground ourselves a little bit more, right? And start to maybe talk a little bit about what is currently available with AI, right?
అంటే మొత్తం పీపీటీ కదా అన్న చెప్పేది ప్రతి మీటింగ్ ఏ పీపీటీ లేనప్పుడే వన్ అయ్యి అదే టూ పెట్టి ఇది ఆన్ చేసుకోండి ఇప్పుడు ఎక్కడ ఈ లెఫ్ట్లో ఖాళీ ఉంది కదా
have actually used anything that you have spoken about so far.
అది పెట్టలేదు
Either use AI for diagnosing a patient or use AI for predicting what is going to happen to the patient. Show of hands, please. Okay, a few. Yeah? Alright. Can I get an example? Maybe sir over there. Can I get an example of what you use AI for? Okay, so quantum computing and quantum biology for drug-drug interaction. I am sure that you are not a doctor. You are? So, pharmacology, right, okay, alright. So, it looks like a lot, and I could probably go around the room and ask a whole bunch of people, right? And it looks like we have been talking, and I have been talking about this at least for the last 8 or 10 years. Yeah, I started working in the AI space about 10 years ago. Right, I'm a statistician by training, right? So I have a PhD in statistics. I did drug research in oncology for about 20 years. Last because I've been in the AI ML space, right? So we've been talking about this at least for the last 10 years. I can tell you, 10 years ago, I was actually working with IIIT Hyderabad and a couple of other institutes to look for solutions around detecting, really hard things at point of care, like for example leprosy. So I was working with the leprosy mission with the government of India to try and see, can we identify leprosy using a mobile phone? Can we take a look at the image, right? Because today, at least at that time, what I understood was that physicians can't
అలా
diagnose
కాపీ
leprosy
చేసుకుంటారంట
just by
ఫైల్
sight alone. It presents itself as something which is similar to a lot of other things, right? And so we said, can I use image detection? Can I use edge nodes? Can I use differentiation of the image to say, hey, is this leprosy or not?
ఇక్కడ వీడియో కానీ
And
ఆడియో
the
కానీ
fact
ఆకుండా
of the matter
చూసుకోండి.
was that while we got
నేను మీకు కాల్
reasonably
చేస్తాను
good
ఎలా
results,
నేను ఇది చూస్తూనే
80,
ఉంటాను మీటింగ్ ఏదైనా మీకు వెంటనే కాల్ చేస్తాను.
you know, correct detection rates, it was never implemented. So even today, we don't have the system where an ASHA worker or somebody could go to a remote village. Because see, that's the problem with leprosy, right? When they think that you probably have leprosy, they do a smear test. You know, the patients also kind of know, and therefore the patients then disappear. Because the smear test doesn't come till the next day. And then the patients disappear to a nearby village because of, you know, all the stigma associated with that disease. So really, we have not been able to implement this. And that is the same thing today, right? I can show you data. And the data will say that we have over 1,200 FDA alone approved medical devices for clinical use. 1,200. The graph has just gone up exponentially. You know, here is the graph. This is how the graph looks. Right? I'm going to come back to some of these slides later. Right? So this is the graph. Yeah? AI/ML device authorizations. And as you can see, exponential increase in the number of devices that the FDA has approved. As doctor said before, a watch, one of the first ones was the Apple ECG watch, right? For atrial fibrillation, was approved. Now there is a difference when I say a government or an FDA or a health authority approved authorization, right? Because that means that it can be used in clinic or at home for clinical use versus a wearable, right? I'm wearing a OnePlus watch now. That has got absolutely nothing to do with an FDA regulator, right? Because it's a wearable. It just tells me what my heart rate is, and I can wear 3 different watches and they'll give me 3 different measurements. Right? So wearables are, I'm not even counting those. Those are probably thousands of millions. Yeah? I'm just talking health authority approved authorization. We still don't see the penetration of these things. Yeah? And so what I want to do is I want to call out a little bit around 3 major areas where I think, you know, the use of AI/ML has been talked about in the healthcare delivery space. Yeah? One of the first is in this area of wearables or medical devices. Yeah? Tremendous amount of, as you can see, work that's been done, approvals that have been granted, but minimal penetration. The second is in the area of clinical decision support systems. Yeah. So, for example, can I, you know, have AI read a pathology report? Yeah. Can it read a radiology report? Ultimately, I as a doctor need to sign off. So it's a clinical decision support. It doesn't make its own adjudication, right? It tells me that I think that this is where the tumor is, right? Or this is where the fracture is, right? It figures that out, or it says this is the count of different parts of my blood, you know, parameters. But a clinician or a pathologist has to sign off on it, right? So that's a second area in clinical decision support systems, right? And the third area is in operations, hospital administration. Can I use AI to cut down my waiting time? Can I use AI/ML to figure out what's the best way to move patients in my clinic? Can I use AI/ML for transcription? Right? And that's the operations or the hospital administration space. So these are the 3 main areas. Okay. Now, while all of us really understand, you know, AI in general, right? Can someone tell me exactly, okay, or maybe not. I want to ask this question because, you know, we are in a place with physicians. Okay. I'm going to talk a little bit about, you know, what are the different kinds of things that we have. Okay. in the AI ML space. So let's talk about the AI ecosystem, right? You start with all the stuff, that Raja and all of those people do from a research standpoint, okay? And that is the AI ecosystem. That's where all the algorithms are built, okay? I think Dr. Arulraj had a slide that he went through very quickly about the different stages of, of the AI ecosystem. You have things like LLMs, transformer models, yeah? They are very, very specific. They are probably at the bottom of the Venn diagram. Above that, you have other things like deep learning. Yeah? Beyond that, you have things like machine learning. And beyond that, you have the whole ecosystem of AI, right? So that's the whole AI ecosystem, right? In that whole ecosystem, we add on what we call our core technologies. All the algorithms that we build on top of all of these things. Yeah? All the imaging, all of that stuff. Part of the core technologies. And we add these two together to come up with clinical applications, which is what a lot of the research groups like IIIT, IITs, all of them tend to do. Right? So this is our AI ecosystem. So very quickly, what I want to say is that if you look at all the different algorithms that we have, it can be split into 3 parts. Yeah? 3 distinct parts. Okay? The first one is what we call supervised machine learning algorithms. Okay, you can almost think of it as somebody, as a teacher who gives you the question and the answer. Okay. So all you have is labeled data. So you have a whole bunch of images and you say this is an image of a cat, this is an image of a cat, this is an image of a dog, this is an image of a donut, not a cat, right? So it have all of these nice labeled images, okay? And you train your data on that, and then you give it new data and say, hey, now can I figure this out? Okay? That's supervised machine learning. Okay? The second part is what we call semi-supervised, which means we have some data, like for example, a chest X-ray. We have some parts which are labeled and some parts which are not labeled, right? And then we use the labeled parts to grow and label the other parts as well. Okay, that is the semi-supervised. And then we have the third part, which we call completely unsupervised. Okay, which is areas of deep learning. Okay, neural networks, completely unsupervised, where the machine simply takes all the data. It doesn't know which is right or wrong. It doesn't know what is a cat, what is a dog. It figures that out for itself. Almost mimicking our brain. Yeah, so these are the 3 parts that broadly you can talk about. And the reason I'm talking about these 3 parts is each one of these is used in a different application. Okay? So for example, the supervised is typically used when you want to make a determination yes or no. Right? So you have an image and you want to see whether a particular part of that image, let's say, image of a brain, or you want to see if it's a microbleed, yes or no. Okay, so you only have that part which says yes or no. Yeah, and those are the areas where you have supervised learning. So when you have radiology support, ECG analysis, when you want to classify risk, yes or no, or high, low, medium. Okay, these are examples where you use supervised machine learning. Yeah. Semi-supervised, again, what you have, as he said, small amounts of labeled data, and you use that to label the other data, and you use it in some of these areas. When you have pathology images, when you want to do things like rare disease detection, a lot of areas in drug discovery, yeah, that's where you use the semi-supervised learning algorithms. Okay? And then the last part, which is around unsupervised, is where you try to look for pattern discovery, detection of anomalies, and so on, right? And you use this when you want to stratify your patients based on a whole number of different risk factors. So you know how you have your differential diagnosis, right? Is this person male? Yes, no. Is this person over 50? Yes, no. Is this person overweight? Yes, no. And you go through an entire differential diagnosis, right? When you have those kinds of things and you want to stratify your patients, you use the unsupervised, or you want to do genomic analysis. Okay? So these are where things are, being used, right? And so we don't have everything all put into one big bucket, right? You use different kinds of algorithms for different kinds of problems. Now, where are we really using most of this stuff? As we said, when we talk about healthcare, wearables and devices, the uptake is very, very low, right? When you talk about, and why is it so low? One of the main reasons is because, think about it, I think all of us have a little bit of resistance to change, right? When we had COVID, everybody was extremely comfortable with telehealth. All of us were fine to call up a doctor, right, through Practo or something else, and say, here is an image, I am on video, you can see me, you can diagnose, tell me what you want, what I should take. You called up the pharmacist and they delivered stuff to your house, left it outside your door. You left it there for 2 days, you put water on it, you did whatever, you washed it with soap, okay? And then you took the medicine. Everybody was okay with that, right? Now, that is extremely convenient, right? You can be at your house, you can do a video consultation. It worked beautifully for everybody. The next thing you know, COVID goes away, everybody is fine to go out. How much telehealth consultations actually happen right now? The latest reports actually show that telehealth consultations have dropped by some 87% post-COVID. 87% telehealth consultations have dropped. Why? It was super convenient for all of us. It was convenient for the doctors, it was convenient for the patients. Why did it drop? And the reason is because somehow, at the end of all of this stuff, right, the patients love going to a doctor, seeing a doctor. Somehow they feel that is more superior. Yeah? And this is not true only for the healthcare industry. Take banks, for example. With ATM and all the online transfers, banks should really not have any more branches, right? The number of branches should reduce. But that's not happening. The number of branches are actually increasing. So you start to wonder, what are people doing in these branches? Why are banks opening up so many branches if everything can be done online? And the fact of the matter is that there is a behavior hurdle here that many of us have to change, right? So for me, as an AI practitioner, while I love what is possible, the art of the possible, I love the imagination of what can really happen. I feel the way that we go about doing this has to be in collaboration with the experts, with the doctors, right? And so what I want to do is I want to take the last 2 minutes to focus on something, and I just have to talk a little bit about LLMs, right? Because everybody loves chat GPTs, right? And we know what chat GPTs are all about. All of us use it, and it's fantastic, And where do we actually use it? A lot on the operational side, synthesis of data, report writing, all of those kinds of things, right? But anyway, so going to where we want to go, I want to say that in the hospital administration, while again, it's really shiny. I know AIG has this thing where you actually go and, Dr. Reddy always makes this joke that people don't want to talk to him anymore. They only want to talk to Nora or whatever that, AI's name is, right? But the fact, again, is that with all the data that we have today, the actual benefit by using AI for hospital administration is only in the range of 5 to 15%. Right? And in terms of using AI for coding accuracy and all of that, right, the gains are only between 10 to 20%, right? So what I'm trying to do here is I don't want to be the person, the AI expert who comes in and says, everybody's been talking to you so wonderfully about everything that is wonderful about AI, but it actually sucks. That's not what I'm here to say. What I'm here to say is that we are early in the game. Right? Where we are is where Raja is, which is in the research side of things. Right? We need to traverse that from research to implementation to penetration. And we are just traversing from research to implementation. So while we are all, caught up and while we are all totally into this thing of AI, I want us to take a step back and say, you know what, there is still some ways to go. And we need to tread this very carefully. So what I want to really do is talk just about the last two slides. Is what do we do? What is a practical roadmap for our implementation checklist, right? And I would say, let's start with actually the clinical need definition. Do we need it? If we have enough radiologists and pathologists, do we need AI to do it? Right? And if not over here, then do we need it in the remote parts of the country? So where is the actual need? Let's try and figure that out. Secondly, let's figure out about bias. Okay, the reason why many of the AI things fail or they don't have enough people adopting it is because of bias. We all know what happened with IBM Watson. We use that constantly as an example. Yeah. So that is the second area. And last, I'll just finish in 30 seconds, right? And then a lot of stuff which is kind of technical, which is what is our architecture? Can we integrate it automatically into what we are doing? How well have we validated this stuff? How well are the clinicians trained on it, right? So let's go through this checklist before we jump onto the AI bandwagon and say that's going to solve everything for us. A little bit around ethics and bias. I won't talk about this slide. This is what I want to close with, is what are some of the recommended next steps for all of you as practitioners, as hospital leaders? What are some of the next steps? I would say start with a strategic pilot. Try and figure out a place where you really need to implement this stuff. Second, demand a lot of validation, rigorous evidence for validation. And third, establish a very, very strong governance structure. You go through these three things, your adoption AI is going to be a lot more better, a lot more feasible than just jumping in and getting mediocre results. So with that, I'll stop. Thank you very much for your attention. Wonderful audience. Thanks a lot for this talk.
Thank you very much for the good presentation, sir.
Thank you very much for this. Thank you, chairpersons, for this. And we will have a small 5 minutes program on one of our Commonwealth Medical Association important agenda. May I now have the pleasure of inviting the immediate past president of the Commonwealth Medical Association, Dr. Murugaraj, the past president, Professor Dr. Arul Raj, the past president and the council chairman for the AA subcommittee, Professor Dr. Vajira, to come to the dais. And also our Commonwealth Medical Association Young Doctors Forum, the vice chairman of the Young Doctors Forum, Dr. Duyan, to come to the dais. I will also recognize the presence of our beloved president of the Malaysian Medical Association, Dr. Tirunavukarasu. I will be happy that we can also join here on the function here. Sir. He has traveled all the way from Malaysia to be part of our program. It is a great honor for us there. Friends, as we are talking about this AI and digital health, and it is the priority agenda of the Commonwealth Medical Association that we need to see entire doctors community of the Commonwealth are getting AI literacy or AI literate, therefore. So one of the venture is the young doctor of our Commonwealth Medical Association, Dr. Duyan, has started a startup program of the supporting this online education program. So CMA is indeed a privilege and happy to sign an MOU with them so that it will be a platform where that we will be able to transmit a lot of AI-related programs for that. I will just request Duyan to talk for 2 minutes on that project.
Very good morning, everyone. Thank you very much for attending the Commonwealth CMA's first AI Global Summit 2025. First of all, I would like to take this opportunity to thank Prof. Jailal, Dr. Prabhu, Prof. Vajira, Dr. Murugaraj, Dr. Arasu, and Prof. Arul Raj for this success, very, very big success on the first summit, AI Summit, Global Summit 2025. This MOU signifies the partnership of digital healthcare. Digital healthcare and AI is the future. Like someone mentioned yesterday, 60% of our work, for clinical work, is already being taken over by AI. So now the question is up to us Do we want to be the doctor that doesn't accept AI and doesn't move forward? Or do we want to be the type of doctor that takes AI as a supplement and works together with AI to further make ourselves better professionals? So digital healthcare is the future. Whether we like it or not, we have to progress forward, and this MOU signifies exactly that. Thank you very much.
Thank you, Dion, and it is a token of we are yet to get the MOU, but our leaders are going to go away. I just request our past presidents of the CMA to say one sentence word to appreciate them. One sentence on that to appreciate Dion.
My real appreciations to Commonwealth Medical Association President Dr. Jayalal and the team for entering into this. That's what I told in my address. We have put the stamp on AI and digital health. We'll take it forward, see that all the 56 countries, embrace it and make Commonwealth a digital forum. Thank you.
Good morning, everyone. It's indeed a pleasure to be here once again at the announcement of this MOU. I think the leadership of the Commonwealth Medical Association has shown the way, but the baton has to be taken by the young doctors and taken to the next level. So the Young Doctors Forum of the Commonwealth Medical Association, under the leadership of our able president from Malaysia, has taken on the baton, and I see that as a very positive development. And I hope all of you here from India as well as other countries will, embrace that and take the initiative that we launched today to greater heights. So with that, I'd like to congratulate the Young Doctors Forum and its president for having initiated this very bold move, and I look forward to seeing the success of that in the years to come. Thank you very much.
Very good morning. A very short one because both our presidents have said most of it, but it gives me great pleasure to actually be here today and also make history with Commonwealth's first step to AI. And being done in the first global summit of the Commonwealth AI event, it gives me, I'd like to congratulate Dr. Dwayne and CMA's Young Doctors Forum for bringing these steps up, taking these baby steps, and I'm sure one day it will reach 56 countries, digitalization of healthcare, and accepting AI into it. We can't run away from it, we can't shy away from it. It is there and we have to embrace it. I also like to take this opportunity to thank Dr. Prabhu and his team, the organizing team, Prof. Jayalal, and everyone for organizing this event. Thank you so much.
Dr. Tirunavukarasu, that's not only the president of the Malaysia Medical Association, he is also the elected in a very tough contest which was held in Portugal as a steering committee member of the World Medical Association. It is always our honor and privilege. It was went for 3 rounds of the election for him to get succeeded. I'll just ask him and bless this moment.